So as we know, African American males are oftentimes underrepresented in the medical field, and HCOP is hugely important because it serves as a pipeline program for persons who may not have traditionally seen themselves in a medical setting, in a research setting, or even in a technology setting. But what Morehouse offers through these pipeline programs and through a program like HCOP is it offers African American males an opportunity to be in a safe environment where they can experience medical research, clinical research, public health research, and the integration of technology. And they can also see persons that look just like them working in these spaces every single day.
Where I'm from, we don't have programs like that locally. So you do see a lot more of summertime teenagers just hanging out because there's nothing to do. So I think having a program that pulls them and gives them not only just education, but also payment, it's enlightening, and it warms me to know that they would even want to do something like this. And then the exposure. I think exposure is very vital. We perish from a lack of knowledge. So be able to be there to inform them that this is what your future can look like, and having different professionals come in and talk to them and sit down with them, teach them the route, is really giving them a different insight that sometimes your community or your household may not have to give you. So I think the knowledge and the environment is really impactful for our African American men.
One of the things that we had the opportunity to do was have focus groups with the students. And one of the things that our African American male students brought up was that everything they see says that African American males are pursuing at a low percentage. So that gets in their heads, because one of the conversations we had was, how does that make you feel? And in many cases it makes them feel like they can't either pursue that particular degree or program or career.
Well, what changed my perspective and let me know that I had all these opportunities in front of me was programs like the HCOP program. You get to see other black males in positions that you want to become, that you want to aspire to one day. And you see that, like a lot of kids that I work with, they see that I'm just like them. I can talk like them, I can joke like them, but on the other side, I do my work. And I feel like this program just lets them see that, hey, if he can do it, I can do it.
Some of those doctors or professionals I bring out say, hey, I was in the same position. I came out of the same household, but they talk about their journey and the exposure to these type of programs that really help them. I have many of my former students that reach out and say, Mr. Lockhart, as a result of the program, I've decided to go into public health, I've decided to go on this particular route just because of the exposure, and I never knew anything about it. Thank you for showing me additional routes to pursue a career.
What we're looking for from the various programs in the pipeline initiatives are for them to successfully guide underrepresented minorities towards STEAM, towards a career in science or biomedical researchers. We're really looking for them to choose a path that doesn't just have to be medicine. If we want them to choose a path in health career that fits their goals and their needs. So really the talent pool is there. Our students are ready and willing. They just need somebody to open up the door and say, this is the pathway. This is how you become successful in the health careers. And that's what we're providing in the pipeline programs. We're providing that pathway and that support. The numbers are crucial, and they're dismal for our population that we're trying to reach out to. These programs are so important that I've dedicated the last half of my life to ensuring that we reach African American males especially, where you're helping people. And so I don't think life gets any better than that.
We're committed to raising the standards of the young black men that we come into contact with, to expand that so that they can see what's possible, and then to facilitate them accomplishing the impossible.